For today's lecture series, we'll discuss microbiology. So first and foremost po, can you or please access the notes posted here in the group. So this one is a 135 item microbiology question, answer, discussion, and rationalization in preparation for your ASCPI examination. You can have it printed for easier jot down of notes, or kahit sabayan nyo po ako, no, as I discuss the different items included in this rationalization. Also, later on, after discussing this 135 item ratio, I will post a subsequent notes and presentation for more questions which is relevant to your microbiology ASCPI microbiology part for your ASCPI examination. And since for ASCPI essential that we are also familiar with some images that may appear in the examination, so I will also post yung mga what I deemed na kailangang matandaan na mga images that may appear in the examination. Okay, so let's start. So first, let's focus on your gram-positive cocci. So this one is a table differentiating your Staphylococcus versus your Micrococcus. In particular, this one is used to differentiate your coagulase negative Staphylococcus versus your Micrococcus. Okay? Because Staphylococcus aureus is known to be coagulase positive, while Micrococcus and other Staphylococcus are coagulase negative. So again, this one is used to differentiate your coagulase negative Staphylococcus versus your Micrococcus. First and foremost, your Staphylococcus is described as a gram-positive cocci in clusters. So they are grape-like cocci, as we observe in your gram stain. While for Micrococcus, they are described as cocci in tetrads or in 4, or in sarcinae or in 8 or more. Okay? So what we have here first is the catalase. So as you can recall, the reagent for catalase is your 3% hydrogen peroxide, wherein the positive result is bubbling or effervescence. So Staphylococcus and Micrococcus are both positive for catalase, meaning again bubbling or effervescence in the reagent, using the reagent 3% hydrogen peroxide. While this one, your catalase test is negative for Streptococcus. One way to differentiate Staphylococcus, Micrococcus versus Streptococcus is through catalase test, because Streptococcus is catalase negative. Next, for aerobic and anaerobic growth, so Staphylococcus is known to be a facultative anaerobe, so it can grow in anaerobic as well as in an anaerobic environment. While Micrococcus, on the other hand, is an obligate aerobe that can only grow in in the presence of oxygen, while it is inhibited or cannot grow in the absence or in an anaerobic environment. Okay, hence for glucose utilization using the oxidation fermentative media or oxidation fermentation carbohydrate test. So Staphylococcus is known to be fermentative, while Micrococcus is oxidative or non-saccharolytic. Speaking of the glucose utilization test, or the carbohydrate oxidation fermentation test. So we are using here bromthymol blue as the pH indicator. So bromthymol blue will change to yellow in the presence of an acid, while for alkaline it will turn blue if wala naman pong nangyaring reaction, then it will remain as color green. Okay, so for the carbohydrate oxidation fermentation, we have here two results, either yellow if there is an acid formation, while it will remain as green kung wala naman pong nangyaring reaction. Okay, and then for your oxidation fermentation, we are preparing an open tube and a closed tube here, wherein the closed tube is sealed with Vaseline and paraffin or mineral oil. Okay, para magkaroon ng anaerobic environment in the closed tube. So Staphylococcus being able to grow aerobically or anaerobically, or being a facultative anaerobe, can utilize the glucose present both in an open tube as well as in a closed tube. So as you can see here, the bromthymol blue turned yellow in the open tube as well as in the closed tube. Okay, hence, Staphylococcus is known as a glucose fermenter. So it is a fermenter. While on the other hand, in comparison to your Micrococcus, so Micrococcus, as what we can recall, is can only grow aerobically, and this one is oxidative. So in an open tube, it can utilize the glucose, while in a closed tube, it remains as color green. Okay, hence, Micrococcus is known not as a fermenter but an oxidizer. It oxidizes glucose. We have your Micrococcus. Okay, marami po pong other examples, but one to take note is Pseudomonas. Pseudomonas species are also non-fermenters. They can't ferment glucose, but they can oxidize glucose. You have your Pseudomonas. While the one naman po that can oxidize maltose is your Stenotrophomonas maltophilia. No? Hence the name maltophilia, which means maltose loving. But again, wag po tayo magkakamali. This one will not ferment maltose. Rather, it will oxidize maltose. Again, oxidizes maltose. We have Stenotrophomonas maltophilia. Okay, going back here, so we're done discussing the carbohydrate oxidation fermentation media, comparing Staphylococcus, which is fermentative, and Micrococcus, which is oxidative. So let's now move to your modified oxidase. So as you can recall, the oxidase test requires the reagent tetramethylparaphenylene diamine dihydrochloride, while for modified oxidase, the reagent, nag-add lang po tayo ng dimethyl sulfoxide. So the reagent to your modified oxidase is tetramethylparaphenylene diamine dihydrochloride with dimethyl sulfoxide. One difference as well, for the oxidase reagent, the positive result is color violet or purple, while for modified oxidase, the positive result is color blue. Okay, so for modified oxidase, Staphylococcus here is negative, while Micrococcus is positive. So modified oxidase is a test for Micrococcus, so it is positive for Micrococcus. Next, you also have benzidine. Benzidine is also negative for your Staphylococcus, but positive to your Micrococcus. Okay, next, for your lysostafine, furansolidone, and bacitracine, antimicrobial tests. susceptibility testing. So Staphylococcus is known to be susceptible to your lysostaphin and furansolidone, while Micrococcus is resistant to your lysostaphin and furansolidone. Next is your bacitracin. Para po hindi ma-confuse, no? Bacitracin, more popularly, we know that bacitracin is your taxo A, and taxo A or bacitracin or your Streptococcus pyogenes group A, Streptococcus is known to be susceptible to bacitracin or taxo A. Tama? So again, ang Streptococcus pyogenes susceptible to bacitracin or taxo A, having a more than or equal to 10 mm zone of inhibition. While for this naman po, bacitracin can also be used, no, in comparing Staphylococcus and Micrococcus. Okay, kasi we know that bacitracin can be used to differentiate Streptococcus pyogenes from other Streptococcus, because Streptococcus pyogenes is known to be susceptible to bacitracin, while the rest are resistant. But for this table, we can also use bacitracin to differentiate Staphylococcus from Micrococcus. Kabaliktaran po nung lysostaphin saka furansolidone, wherein Staphylococcus is resistant, Micrococcus is susceptible. Correct po natin to spelling. We have susceptible. Okay, for your Micrococcus. Okay, so again, review po tayo. No? This is very essential. Staphylococcus, gram-positive cocci in clusters, grape-like cocci. Micrococcus, we have cocci in tetrads or group of 4, or in sarcinae group of 8. Okay, so this, your Staphylococcus aureus is coagulase positive, while the rest of the Staphylococcus are coagulase negative, while Micrococcus is also coagulase negative. Okay, so we are comparing here coagulase negative Staphylococcus versus your Micrococcus. And again, Staphylococcus is a facultative anaerobe, so it can grow both in an aerobic as well as in an anaerobic environment, while Micrococcus is an obligate aerobe that can only grow aerobically. So Staphylococcus can utilize glucose both in an open tube and in a closed tube. So this one is known to be fermentative, while Micrococcus can only utilize glucose in the presence of oxygen, as seen in the carbohydrate glucose utilization, oxidation, fermentation media. So Micrococcus oxidizes glucose. Okay? While for modified oxidase nga po, it is positive to your Micrococcus. Benzidine is positive for Micrococcus. Micrococcus is known to be resistant to lysostaphin and furansolidone, while susceptible is the Staphylococcus. Micrococcus is known to be resistant to susceptible to bacitracin, while Staphylococcus is resistant to bacitracin. Okay? Okay, so again for this one, Staphylococcus is known as a fermenter, while Micrococcus is an oxidizer. Aside from Micrococcus, also take note of Pseudomonas being not a fermenter, but it rather oxidizes glucose. While we also have Stenotrophomonas maltophilia, sa name pangalang po niya, maltophilia, maltose loving, but this one is not fermenting maltose, rather it oxidizes maltose. Stenotrophomonas maltophilia. Okay, so again, in summary of your comparison, no? So Staphylococcus is susceptible to lysostaphin, susceptible to furansolidone, resistant to bacitracin, microdase or modified oxidase negative, and this one is a facultative anaerobe. While for Micrococcus, this one is resistant to your lysostaphin, resistant to your furansolidone, susceptible to bacitracin, modified oxidase or microdase positive, and this one will only grow aerobically. Again, Staphylococcus is a fermenter, while Micrococcus is an oxidizer. Okay? Clear po ba tayo doon? Okay, clear po doon. Okay, so let's now move to your Staphylococcus. So Staphylococcus species are generally described in colonies as having pin head colonies. So most important to take note is your Staphylococcus aureus. So Staphylococcus aureus is a gram-positive cocci arranged in clusters. as a general characteristic of your Staphylococcus. They are medium to large raised colonies on blood agar with cream to golden yellow pigmentation. They can be beta hemolytic or non-hemolytic. But more importantly here is they exhibit beta hemolytic. Next, so we also your Staphylococcus aureus, as we described a while ago, is known to be coagulase positive. And we have two tests here for coagulase. We have the slide coagulase that detects the bound coagulase or the clumping factor. So this one is wherein Staphylococcus aureus is positive by showing clumping. While we also have tube coagulase. So again, slide coagulase and tube coagulase. For tube coagulase, it detects free coagulase, wherein the positive result is a gel-like fibrin clot. Gel-like fibrin clot. So your free coagulase or your tube coagulase serve as a confirmatory to your slide coagulase. So kapag nag-negative po sa ating slide coagulase, it should be confirmed by your tube coagulase that detects free coagulase. However, for your tube coagulase that detects free coagulase, wherein the positive result is a gel-like fibrin clot, this one should be checked every 30 minutes within 4 hours. Because as we know, Staphylococcus aureus also produces fibrinolysin or staphylokinase that can lyse the gel-like fibrin clot causing false negative result. So para maiwasan nga po yung false negative na result, we are checking for the presence of a gel-like fibrin clot in your tube coagulase test every 30 minutes within 4 hours. Okay? So culture medium for your Staphylococcus is your mannitol salt agar or MSA, wherein MSA is both selective and differential culture medium. As a selective culture medium, it uses 7.5% NaCl that will only allow the growth of your Staphylococcus. So that high amount of salt will only allow the growth of Staphylococcus, Staphylococcus aureus, Staphylococcus epidermidis, Staphylococcus saprophyticus. While it is differential because of the presence of mannitol, because not all Staphylococcus can ferment mannitol. So Staphylococcus aureus is known to ferment mannitol, while other Staphylococcus epidermidis, saprophyticus, they can't ferment mannitol. Okay, quick review po tayo ng mannitol salt agar. The mannitol salt agar contains phenol red indicator. Yung ating pong phenol red na indicator, it will change to yellow kapag there is an acid formation, while it will turn into red kapag alkali, while kapag neutral, ibig sabihin wala nangyaring reaction, it remains as color pink or colorless. So in that case, since Staphylococcus aureus can ferment mannitol, so magkakaroon ng acid formation, so Staphylococcus aureus will show yellow colonies in mannitol salt agar. While other Staphylococcus epidermidis, saprophyticus, they will exhibit or they will show pink or colorless colonies. Okay? So that's for your mannitol salt agar. Next is your DNase test. So your Staphylococcus aureus can also produce DNase, wherein or DNase positive nga po siya, wherein we are detecting this one using a DNA medium with methyl green. So if the organism like your Staphylococcus aureus can produce DNase, so it can clear the medium. So mawawala po yung green color ng DNA medium with methyl green. Magkakaroon ng clearing of medium, which is positive to your DNase test. Aside from Staphylococcus aureus, we have 3 organisms po that can produce DNase. We have Staphylococcus aureus, we have Moraxella, and we have Serratia. Again, Staphylococcus aureus, Moraxella, and Serratia. Next, we have your Staphylococcus epidermidis. Just like your other staphylococcal organism, they are gram-positive cocci in clusters. Ganun din po ang Staphylococcus saprophyticus. Okay? They are more of a non-hemolytic, and they are less kasi Staphylococcus aureus is golden yellow, while for epidermidis, white, creamy, like also to your Staphylococcus saprophyticus. So again, other Staphylococcus can grow on mannitol salt agar, but they can't ferment mannitol. So they will be presented as colorless or pink colonies in your mannitol salt agar, while aureus turns yellow. Again, Staphylococcus aureus coagulase positive, while the rest of the Staphylococcus are coagulase negative. Staphylococcus aureus is DNase positive, while the rest are DNase negative. For us to differentiate Staphylococcus epidermidis to Staphylococcus saprophyticus, we are using novobiocin antimicrobial testing, wherein Staphylococcus epidermidis is susceptible to novobiocin, while saprophyticus is resistant to novobiocin. Okay, for easier memorization, or para di po tayo confused, we have senior N, SRN, Staphylococcus saprophyticus, S, R, resistant to N, novobiocin, SRN, Staphylococcus saprophyticus, resistant to novobiocin, while epidermidis is susceptible to novobiocin. Okay? Having more than or equal to 16 millimeter zone of inhibition. So to differentiate Staphylococcus epidermidis and Staphylococcus saprophyticus from your Staphylococcus aureus, so they are coagulase negative, they are DNase negative, and they cannot ferment mannitol. To differentiate naman epidermidis to your Staphylococcus saprophyticus, we are using nga po novobiocin, wherein saprophyticus is resistant to novobiocin, while epidermidis is susceptible to novobiocin. For their common pathology, for Staphylococcus epidermidis, this one can cause bacterial endocarditis from artificial heart valves or prosthetic heart valves. Again, bacterial endocarditis due to prosthetic heart valves or artificial heart valves. This one can also be present as a contamination in blood culture, your Staphylococcus epidermidis. While for Staphylococcus saprophyticus naman po, this is commonly associated with urinary tract infection or UTI among young women. Okay? So, Staphylococcus saprophyticus. Okay, so we'll now answer some questions starting with number 1. So last time I've asked you